Dr. Maggie Labarta is President and CEO for Meridian Behavioral Healthcare. Maggie is a clinical psychologist with 36 years of experience, 18 of those as Meridian's CEO, where she sees the impact mental illness and addiction have on people's lives and families on a daily basis, and where she sees the hope and real recovery from those illnesses that happen when people can receive timely, evidence-based treatment. Welcome, Maggie.
Thanks. Great to be here.
I think you are our most frequent guest on Alachua County Talks since 2004.
That's actually a privilege. I'm happy to have that honor.
You know, things change, and certainly there's a lot of turnover of population in Gainesville, so we like having you on just to kind of fill people in on the history of Meridian, but also what's going on right now. So why don't we start a little bit with you, though, and tell us your history with Meridian and coming to Gainesville, and who are you, Maggie?
So I came to Gainesville the way a lot of people come to Gainesville. I did an internship at the university, actually in the College of Health Professionals back in longer ago than I want to admit, 1980. I was going to be here for a year or two, got married, and my husband at the time was in a residency program, and I needed a 2-year job to tide us over 35 years ago.
So that's how that's when you began with Meridian?
That's when I began with Meridian, thinking I'd be there a couple of years. And really found out that even though clinical psychology was certainly the field I had been training for, doing that in a community mental health center just won my heart. It is amazing work, and what we're able to do for people who are often among the most disenfranchised members of our community became my passion, and so here I am 35 years later.
So you've been the CEO for 18 years,
right.
But what was your position when you started?
I was a half-time supervisor, half-time direct service person out in 2 of our rural communities to the west in Dixie County and Gilchrist County. And then kind of became the head of the whole rural community, which at that time was only 3 counties. And then moved into Gainesville to do our crisis unit, then our children's programs. I keep telling people I've had 7 jobs. They all happen to have been at Meridian. And we've certainly grown quite a bit since then. We're now in 12 counties and cover about 7,000 square miles.
So in a nutshell, what is Meridian? Tell us when it started, the genesis of it.
So Meridian's been around for about 2018, so 46 years, 47 years. And we started out really as part of a movement to create community mental health centers across the country. We had a grant from the federal government to help people who were being discharged from the state psychiatric hospital back into the community, and the impetus was helping those people reintegrate. When the grants became available from the federal government, that quickly expanded to include more diverse populations, adults, children. Substance abuse then became part of the mix. And so initially there were 2 mental health centers in this part of the state, one that covered 4 counties in the south, one that had 8 counties just north of us, and eventually we merged in 1996, became Meridian Behavioral Healthcare, and have since provided services to varying numbers of counties over the years, depending on funding and what counties choose to do. But right now we are we're providing services to people from 12 counties as a core service area, but we really see lots of people from any county that touches those 12. So it's quite a large area.
Do all of those patients travel to Gainesville?
No, we have clinics in 11 counties,
okay.
Actual on-site locations, and those clinics provide outpatient services. So it can be counseling, psychiatric care. It can also be case management for people who need help finding the resources they need to be stable and live a fulfilling life in the community. Our residential and inpatient programs are all either in Lake City or Gainesville, partially because we want to be close to the major medical hospitals, because those folks often come with problems that bridge both mental health and physical health. And so we want to make sure that we are able to meet all of their needs. So volume and scale makes it easier to have those kind of services in 2 locations rather than try to. Lafayette County has 8,000 people. We would never be able to have an inpatient unit in that county.
Sure. With all your different facilities, all the services you provide, how many people do you serve in a 12-month period?
We just finished up our fiscal year, so this year it looks like it's going to be close to 20,000 people who will have received some treatment service from Meridian. And then we do lots of outreach, health fair, community prevention, and that probably touches another 10, 15,000 people.
How are you funded? I know you mentioned I know you get federal funding. I know you get funding from the county commission.
Yeah.
What else?
So we have, state of Florida has funding for indigent care for people who have a mental health issue or a substance use disorder. And so that's about 40% of our funding.
Is that passed through from the federal government?
Some of it is passed through from the federal government. That funding comes through the Department of Children and Families and then through a managing entity that does their administrative work and then in contracts to mental health and substance use disorder providers like us. Another 45 or so percent is Medicaid. So it means that 80-some% of our population is indigent. And then we also take third-party commercial insurance, United, Blue Cross Blue Shield. Some patients pay fees depending on a sliding scale based on their income and family size. The counties contribute matching funds and also sometimes purchase services. Alachua County in particular, in addition to doing matching grant funds with us, also pays for some services directly. And then we have grants. We have a number of grants, some of them on our own, some of them in partnership with counties like yours. We actually, I think, are up to 3 or 4 now that we partner with the county on. And it's all to create as comprehensive a scope of services as we can.
I know I see you frequently in Tallahassee when I'm up there lobbying for county issues, and so you're also looking for kind of project-specific funds in Tallahassee?
Project-specific, but also really helping, and one of the nice things about the size and scale that Meridian has is that we really are able to, in some ways, partner and consult with legislators on how they design the system of care for the state. And so I'm up in Tallahassee both advocating for funding locally, but also for creating a system of care that meets the needs of Floridians across the state, and also to make sure that the way that they define services really does match up to the science, right? So that it isn't designed without some understanding of how to provide services in the most effective and efficient way possible, because cost is certainly part of what they're concerned about.
We frequently hear at county commission meetings with some chagrin that Florida is not doing real well when it comes to funding mental health services. I think the last time I heard we were 50th out of 50 states. Is that still accurate?
50th out of 51, because we include the District of Columbia in the mix. So yeah, and we had been 47th, 48th, so we've actually declined in per capita funding. And the irony of that is that we get touted as a state that knows how to do a lot of really good things with no money, which is in some ways unfortunate and in some ways fortunate, right?
Right.
So yeah, it is a very challenging environment in which to provide the services, and certainly is a continual issue. And I think one of the things you mentioned, projects, local projects that we try to fund, and what that means is that sometimes we don't have a good continuum because we have these little pots and these projects. We had a primary care clinic that was funded entirely by state dollars, and that project ended, and we did not get refunded this year. So we're trying to figure out now how to keep it up and flowing, because it has been an amazingly effective thing for us to do. So we're not willing to give it up. We just now figure how to cobble funding from other places to.
Will you be taking another run at that in 2019?
Absolutely.
Yeah.
Yeah.
Yeah. I wanted to ask you about, you're well aware of the work that the Children's Services Advisory Board is doing. And their work, of course, would dovetail into the ballot initiative that's on the November 6th ballot with the Children's Trust. It's my understanding that you have been involved in the project that's dealing with kind of emotional well-being of children?
Yeah, the Early Intervention Project.
Mm-hmm.
Yeah, we're actually finalizing the contract to do that program in partnership with Partnership for Strong Families.
Yeah.
It's hard we partner with them on a lot of things, and then their name is sort of like redundant, but they're amazing partners. And so we've developed this grant project with them, and we're hoping to really make a difference in early childhood. But just more broadly, wow, what an amazing project, the Children's Trust. And I think we know so much about what happens 0 to 5 and the importance of 0 to 5 in the well-being, graduation rates, employability, just the downstream impact of those first 5 years. So having a Children's Trust and having a dedicated funding, I think will make this community better than it already is. And I mean, aside from the fact that I love what I do at Meridian, I'm so happy to call this community home because I just love the things we do here.
Yeah. Let's dig into just the kind of the nuts and bolts of what you do, and let's talk about mental illness and substance abuse. How common are they?
1 in 5.
1 in 5.
So, and whether you're an adult or a child, the likelihood that you have a mental illness at any given point is 1 in 5 Americans will have one. Substance use, a primary substance use disorder, affects 10% of the population. But once you have one, the likelihood of the other goes up. So there's the theory that people self-medicate with substances, right? And so you're trying to treat an underlying mental health issue. And then if you have a mental health issue, you feel isolated, you feel alone, you feel pain, and you go that way. So either way you can go. And so we assume both are potential issues when we see someone coming in the door and asking for help. And then we try and figure out what's the balance and which do we need to address first. If somebody is very actively using and addicted, it's very hard to deal with a mental health issue until you clear them of the drugs.
Right.
And if somebody has a mental health issue, then we certainly want to assess and deal with the risk that they face around substance use. So we try and treat those in a very integrated manner.
And I'm assuming, well, I know there's a spectrum. Some people are functioning, some people are completely non-functioning. Right. So you deal with the entire spectrum.
It's a real continuum, and I don't even think it's a continuum from mental health to mental illness, and it's a continuum from use to misuse to addiction. Mm-hmm. And so both of those are on a continuum, and the services that you might need depending on where you are on that continuum are vastly different. And so part of what we try to do is have services that touch all of those points. So our prevention efforts are geared at people who right now don't have any signs of any kind of illness, but we want to help them have the self-help skills, if you will, the mental health skills, right? We teach about exercise and healthy diet. Well, there are healthy mental habits as well, mm-hmm. That we can use to then help reduce the risk of them having an illness. And certainly the ones that work for mental illness, not surprisingly, also work for substance use. So we do prevention. And then for those folks that are in an acute crisis, we have our crisis stabilization unit, our detox unit, to help get them into treatment in a very safe environment, regardless of how out of control their life has become as a result of either the mental illness or the substance use.
You know, you come in front of the board once a year at least.
Yes.
To give your report, and I'm always really impressed by the data that you bring with you, and I'm assuming with all of the funding sources you get, being able to track the data is critical. This is kind of a broad question, but maybe you can break it down and talk about different categories, but how effective is treatment? So
treatment, and again, let's look at that continuum, right? What we see in our general population is that 70% of adults and 80% of the children that come to us, actually closer to 85% of the children, see improvement in their functioning over a course of treatment. For people with a very severe form of illness, it's in the 40 to 60% range, and people say, well, that doesn't sound all that great. Well, guess what? It's the same percentage rate as cancer, diabetes, heart disease, all chronic illnesses right now, state of the art, with one exception, show a 40 to 60% improvement. One of the things that is most concerning to us is that over the last 2 decades, we have seen significant declines in mortality associated with heart disease and cancer and diabetes and those kind of chronic medical conditions that we all hear about all the time. The curves have been steeply declining. Suicide is the only one that's steeply rising.
Is that right?
And it is now the second leading cause of death for young adults. And it is something that we should all be concerned about in the community. And that's a combination of access to treatment, but it's also research investment and knowing that there is research into what are the evidence-based practices. And one of the things that I try to emphasize is that these are serious illnesses. Mental illness and addiction are serious and chronic illnesses in some cases. And like all of those kinds of illnesses, they have a mortality rate attached to them. And I think it's incumbent on all of us to really move toward more effective treatment and investing in the science that drives that.
How do people come to you? I mean, do you? I know you have relationships with law enforcement. I'm sure you get referrals. You mentioned that a large percentage of your patients are indigent. Mm-hmm. So what are all the different ways that the intake or the...
Every which way you can imagine. People call about themselves or their children. So we get referrals. Self-referrals are a significant number of the folks who come in. It has a lot to do sort of with that severity scale, right? If I break an arm, I'm very acutely aware that I've broken an arm because it hurts and it's bent and it doesn't look right. If I have a mental illness that's serious, what is impaired, what is not broken but not well, is my brain, and that's what we rely on to self-evaluate and make decisions. And so often with people with a very severe episode of illness, the first thing that goes is their ability to determine that they've got one. Right. So those are the people who come in on law enforcement or a health professional involuntary basis often. But once they recognize the illness, they sometimes bring themselves back because they realize the path is repeating. But we get law enforcement, we get physician referrals, we get child welfare system referrals, we get school referrals, we get self-referrals, we get them from all over.
Do you have a secure facility there?
We have 2 secure facilities, one here and one in Lake City, and those are our crisis stabilization units. Right. And they're secure because we want to protect the safety of the people who are there. Again, if your judgment is impaired and you think you can leave and you are suicidal or psychotic and can't really take care of yourself, we want to make sure that you're in a safe environment.
I often hear that the largest provider of mental health services in the United States is the jail system. But
in Florida, it's the Miami-Dade County Jail.
Is that right?
Mm-hmm.
So you have somebody who you would think would need to be in jail. You have the ability to take that person into a secure area.
It depends. So we don't take anybody who's committed a violent act. We do not.
Right.
That is just not. We're not secure in a criminal justice sense of secure. We're secure in a patient safety sense of secure.
Gotcha.
So we don't have people who are actively involved in the criminal justice system. One of the things that we have seen is the commitment in this county to crisis intervention training for law enforcement and mental health first aid training for many others in the community. And I think we just finished this year trained, I want to say 1,300 people in Alachua County in mental health first aid.
It's my understanding that every Alachua County employee has gone through it. I went through it.
Yeah.
It was a wonderful program.
And the city is not far behind. We just have done some with the fire and EMS folks. So we're seeing more and more of that. And one of the things that I'm really pleased about is when you have law enforcement, EMS, and the lay community trained in recognizing that someone may be mentally ill, then it's so much easier to decriminalize whatever behavior is happening, right? So we see law enforcement making the decision to bring someone to our facility rather than arrest them. They could, I mean, if you shove the police officer, yeah, they have that option, right? But if that police officer has the understanding that perhaps, oops, they shoved me because they are mistrusting me and there's a mental health issue involved, and perhaps it wasn't an intentional attack on a law enforcement, but rather a product of that illness, they're going to make a different decision. And we've seen that begin to play out, and I think that's really critical. And we've seen it in the jail population, which is not as stressed by A lot of our jail diversion efforts in partnership with the county emerged when the data began to show that lots of the folks that were in the jail had issues that if we could address them in treatment, they wouldn't need to be at the jail and they wouldn't need to have the arrest. So,
You know, Maggie, I never have enough time with you.
I know.
I've got to kind of hurry up here because I know there's a couple things we have to talk about. The kind of pervasive fear centered around violence in America, mass shootings. You know, I'm sure that that's something that you all have to deal with. So how has that impacted what you do?
You know, it's been an interesting process. That I've spent most of my career letting people know that folks who have a mental illness are among the least dangerous people in the community. They are much more likely to be the victim of a crime than the perpetrator of a crime. But there is the small subset, a very small subset of people whose illness leads to violence. And so the more that we can get those people into treatment, because one of the things we know even about that subset is that once in treatment, if you can get them engaged and kept in treatment, that risk really comes down. I think the other thing that we need to be careful about is that just because you commit a violent act does not make you mentally ill. It may not make you mentally healthy, and that's what we see with some of these mass shootings. The person, and then the question is, why were they not in the mental health system, right? How did we miss this? Well, they aren't always mentally ill in the way that clinically we define that. They certainly are alienated. They certainly are not feeling like society is responding to them in an appropriate way. And they may therefore not be mentally healthy. Just like if I'm overweight, I may not be particularly healthy but not have yet diabetes or hypertension, right? So I don't have a diagnosable illness. I'm clearly not in the healthy camp either. Mm-hmm. So that's where we need to really begin to intervene. And that's why I think it's so important that we do things to support people in the community, support health, and then address the problems that way. Why are they alienated? What are the social supports that we can put in?
Speaking of addressing issues, certainly the opioid epidemic has been one that's been discussed and is kind of in the public consciousness now. How is Meridian helping with those issues?
So we've had programs that help with opioid addiction straight through for the last 15 years. We have 2 methadone clinics, which are the traditional way of dealing with folks that are addicted to opiates. One of the things that we've seen is that as Florida really clamped down on the pill mills, and Florida was the premier pill mill state, right. People have gone from pills to heroin. And heroin, so pills have gotten very expensive on the street, heroin's become fairly cheap, and you no longer have to inject it. So heroin is now becoming more prevalent. The federal government and the state government have both declared emergencies and really freed up dollars. So we've been able to expand our services. So we now do methadone, and we do 2 other medication, forms of medication-assisted treatment that really let us attune how we deliver care to the needs of the person, right? So if you're working, you can come in the evening and have this. We now have an outpatient detox protocol, so that if, again, what we want to do is make sure that person stays as engaged in their routine of daily life, keeping their family, keeping their job, keeping all of those. So we have now an array of services, many of them supported by medication, which is the evidence-based approach to treating opiate addiction, something called medication-assisted treatment, and there are 3 drugs now that are available. So we have active programs for all of that, and so we've been able to really expand those services.
Tell me about the Cabby Grant. I won't ask you to say what the acronym means.
Thank you. So that one is another partnership with the county. The county is the grantee, and we're providing the substance abuse treatment and mental health treatment. And the goal is to get people to where they are stable enough to remain in housing. So we're doing lots of outreach, trying to find these folks that have the illness. We know that of the homeless population, 80% of the population that's homeless is sort of transiently homeless, right? But there's this core 20%, and that's where you find the highest prevalence of serious mental illness and addiction. And that's the group we're trying to target, and trying to get them the services they need in order to make them more stably housed. We're not providing the housing. This is really around the treatment supports that they need in order to maintain and housing and to really get into housing and then be able to stay there.
Do you have a direct working relationship with Grace Marketplace?
Even without this grant, we do. Yeah, we've had some people outposted there, because we also have a supportive services for veterans grant through the VA, which is also aims at rapid rehousing for veterans and their families. And we've been doing screening for mental health and addiction out at Grace. So we've been a partner at Grace from the beginning. It's yet another one of those initiatives in the county that I personally support, as well as partnering through Meridian.
Yeah. Tell me a little bit about the vocational and housing services. I mean, I guess that's part of what you were just talking about, but...
So we have a number of things. So we have some grants to do housing. Some of it are actual vouchers, HUD vouchers for grants. We work with the Alachua County and Gainesville housing authorities to do that. We're very engaged with them. We actually manage 5 low-income houses for the county. And we actually have 4 interrelated HUD corporations that target people with psychiatric disabilities. So we have apartment units and 2 group homes that are HUD projects, but that Meridian does the housing management, and we're essentially the landlords. And that helps us, again, have an avenue for helping people who are otherwise unable to find housing. It is the primary reason for a readmission to an inpatient psychiatric unit.
Is that right?
Housing, well, think about it. If your belongings are in a black plastic bag, how are you going to find your medication? How are you going to keep it routinely? So housing and the loss of housing is critical to everything that we do at Meridian, because without housing, people can't really maintain stability of their mental health or substance use issues. So we also have, we bought the Gator Lodge some years ago, and we now operate it as transitional. We run it like a motel. It runs like that for transitional housing for people as we try and get them from deeper end treatment and back into the community, so they have a safe and sober place to stay.
What do you do with your spare time? Can you talk about what your goals are this year up in Tallahassee, or is it too early for that?
I think one of the big goals in this year's session is going to be sustaining the funding. You know, we deal with these crises, opioid crises, so we want to really get stable funding that's level, and then we want our primary care clinic funding to be restored if we can possibly do that. And other than that, just really support the efforts of Floridians that need this treatment.
Well, Maggie, it's always great to talk to you.
It's great to talk to you too. And time does run too short, doesn't it?
Does.
Thank
Good to
you
see
very
you.
much.